Welcome to the CPHIMS Exam Preparation Podcast. In today's episode, we are going to learn how to develop mechanisms to facilitate ongoing clinical content and decision support tools. Developing mechanisms to facilitate ongoing clinical content and decision support tools in healthcare requires a comprehensive strategy that encompasses technology integration, content management, and continuous evaluation. Here's a framework for this process. Needs assessment and planning. Technology infrastructure. Content development and management. Implementation of decision support tools. Testing and quality assurance. Monitoring and evaluation. Ensuring compliance and ethical standards. Scalability and adaptability. Let's delve into each topic. Needs assessment and planning. Needs assessment and planning for decision support tools. 1. Stakeholder engagement. Inclusive collaboration. Engage a wide range of stakeholders, including clinicians, IT specialists, administrators, and potentially even patients, to gather diverse perspectives. Understanding user needs. Use interviews, surveys, focus groups, or workshops to understand the specific needs and preferences of these stakeholders in relation to decision support tools. Expert input. Consult with clinical experts to ensure the decision support tools align with current clinical practice and standards. 2. Identify requirements. Clinical content needs. Determine the types of clinical content necessary for the decision support tools. This might include treatment guidelines, diagnostic protocols, best practice recommendations, drug interaction information, and more. Customization for specialties. Identify if there are specialty-specific requirements. For example, the needs for a decision support tool in oncology might differ significantly from those in pediatrics. Data sources. Identify reliable and authoritative sources for clinical content, ensuring the information is up-to-date and evidence-based. Implementing the needs assessment findings. Prioritization. Given the vast scope of possible content, prioritize the content development based on factors such as impact on patient care, frequency of use, and stakeholder urgency. Content development plan. Develop a detailed plan for content creation, including timelines, responsibilities, and resources needed. Continuous feedback and improvement. Iterative development. Utilize an iterative approach to content development, allowing for ongoing stakeholder feedback and adjustments. Pilot testing. Before full deployment, pilot the decision support tools in a controlled setting to assess functionality and gather user feedback. In summary, a comprehensive needs assessment and planning stage is crucial for the successful development of decision support tools in healthcare. Engaging with a broad range of stakeholders and clearly identifying the requirements for clinical content ensure that the tools developed are not only technically sound but also clinically relevant and user-friendly. This process sets the foundation for creating effective, evidence-based decision support tools that enhance clinical decision-making and patient care. Now, let's proceed to the next section. Technology infrastructure. Technology infrastructure for decision support tools in healthcare. 1. Select appropriate platforms. Compatibility with existing systems. Choose software platforms that can be seamlessly integrated with existing electronic health records, EHRs, and other clinical information systems. This ensures that the decision support tools are part of a unified system, enhancing their usability and effectiveness. Scalability and flexibility. Opt for platforms that offer scalability to handle increasing data volumes and flexibility to adapt to evolving healthcare practices and technologies. User-friendly interface. Ensure that the chosen platform has a user-friendly interface that simplifies interaction for clinicians and healthcare providers, thereby encouraging adoption and use. 2. Ensure interoperability. Standardized data exchange. Utilize platforms that adhere to healthcare data exchange standards such as HL7, EHR, or other relevant protocols. This ensures that decision support tools can effectively communicate and exchange data with various healthcare IT systems. API integration. Make use of application programming interfaces, APIs, that allow for smooth integration and data exchange between different software systems, enhancing the functionality and reach of decision support tools. Testing interoperability. Rigorously test the interoperability of the platform with existing systems to ensure seamless data flow and functionality across different healthcare IT environments. Implementing the technology infrastructure. Collaboration with IT specialists. Work closely with IT specialists and developers during the implementation phase to ensure that the technical aspects align with clinical needs and workflows. Continuous monitoring and testing. Regularly monitor the performance of the technology infrastructure, conduct stress tests, and make adjustments as needed to maintain optimal performance. Adapting to future needs. Stay updated, keep abreast of technological advancements and evolving standards in healthcare IT to ensure the decision support tools remain current and effective. Feedback loop. Establish a feedback mechanism with end users to continuously gather insights and suggestions for technological enhancements. In summary, establishing a robust technology infrastructure is crucial for the successful implementation of decision support tools in healthcare. Selecting the right platforms and ensuring interoperability are key steps that facilitate the seamless integration of these tools into the healthcare workflow, thereby maximizing their utility and impact on patient care and clinical decision-making. Now, let's proceed to the next section. Content Development and Management. Content Development and Management for Decision Support Tools. 1. Source reliable content. Evidence-based information. Ensure that the clinical content is sourced from reputable, authoritative sources. This includes peer-reviewed medical journals, clinical research findings, and guidelines from recognized medical associations and institutions. Verification and validation. Implement a process for verifying and validating the accuracy and relevance of the information before it is integrated into the decision support tools. 2. Content customization. Tailoring to local needs. Customize the content to reflect the specific needs and practices of the healthcare setting where the decision support tools will be used. Consider factors like local treatment protocols, prevalent diseases, and patient demographics. User-centric approach. Involve clinicians and healthcare providers in the customization process to ensure that the content aligns with their workflow and clinical practice. 3. Regular updates. Staying current. Establish a regular review process for updating the clinical content. This ensures that the decision support tools always provide information that reflects the latest medical research and clinical guidelines. Scheduled reviews. Determine a schedule for content review and updates, which could be quarterly, biannually, or annually, based on the nature of the information and how frequently changes occur in the field. Feedback-driven updates. Incorporate feedback from users into the content update process. Clinicians and healthcare providers can provide valuable insights into emerging needs and changing practices. Implementing content development and management. Dedicated team. Form a dedicated team responsible for content development and management. This team should include clinical experts, healthcare informatics specialists, and content managers. Technology integration. Utilize content management systems, CMS, that allow for easy updating, managing, and disseminating of clinical content within the decision support tools. Ensuring quality and compliance. Quality assurance processes. Implement quality assurance processes to regularly check the accuracy and reliability of the content. Compliance with standards. Ensure that content development and management practices comply with regulatory standards and ethical guidelines. In summary, effective content development and management are key to ensuring that decision support tools in healthcare are reliable, relevant, and beneficial to healthcare providers. By sourcing evidence-based content, customizing it to specific healthcare settings, and maintaining regular updates, healthcare organizations can enhance the quality of clinical decision-making and ultimately improve patient care outcomes. Now, let's proceed to the next section. Implementation of decision support tools. Implementation of decision support tools in healthcare. 1. Integration with clinical workflow. Seamless integration. Embed the decision support tools into the existing clinical workflows in a way that feels intuitive to the healthcare providers. The tools should complement and streamline clinical processes rather than disrupt them. Workflow analysis. Before integration, conduct a thorough analysis of current clinical workflows to identify the best points for incorporating decision support tools. This might involve embedding tools within EHR systems, diagnostic processes, or patient management protocols. Customization and configuration. Customize and configure the tools to align with specific clinical practices and preferences of each department or specialty within the healthcare facility. 2. User training. Comprehensive training programs. Develop and provide in-depth training programs for all users of the decision support tools. This should include practical demonstrations, hands-on practice sessions, and discussions on how to integrate these tools into daily clinical tasks. Role-specific training. Offer tailored training sessions that address the specific needs and roles of different user groups, such as physicians, nurses, and other healthcare staff. Ongoing support. Establish a support system, including help desks, FAQs, and user manuals, to provide ongoing assistance and resources as healthcare providers become accustomed to the new tools. Ensuring successful implementation. Pilot testing. Initially, consider conducting pilot tests in selected departments or units. This allows for monitoring the integration of the tools into clinical workflows and making necessary adjustments. Feedback and iterative improvement. Continuously gather feedback from the users and make iterative improvements to the integration and functionality of the decision support tools. Evaluation of impact. Assess the impact of the tools on clinical workflows, efficiency, and patient outcomes. This evaluation will help in understanding the effectiveness of the tools and guide further enhancements. In summary, the successful implementation of decision support tools in healthcare hinges on their seamless integration into clinical workflows and comprehensive training for all users. By ensuring that these tools are intuitive and enhance existing clinical processes, healthcare organizations can maximize their adoption and effectiveness, ultimately leading to improved clinical decision-making and patient care outcomes. Now, let's proceed to the next section. Testing and quality assurance. Testing and quality assurance for decision support tools. 1. Pilot testing. Initial testing. Begin with pilot testing in a controlled environment, such as a specific department or unit within the healthcare facility. This allows for the monitoring of the tool's performance in a real-world setting. Gathering feedback. Collect detailed feedback from the users involved in the pilot test. Focus on aspects like usability, integration with clinical workflows, and the tool's impact on decision-making processes. Adjustments based on feedback. Use the feedback to make necessary adjustments to the decision support tools, refining features, and resolving any issues identified during the pilot phase. 2. Quality control. Accuracy of information. Implement measures to verify the accuracy and relevancy of the information provided by the decision support tools. This includes regular checks of the clinical content and decision logic. Reliability testing. Conduct tests to ensure the reliability and stability of the tools, especially under different clinical scenarios and usage loads. Compliance with standards. Ensure that the tools comply with relevant healthcare standards and regulations, including data privacy laws and clinical guidelines. Implementing testing and quality assurance findings. Iterative improvement. Use an iterative approach for continuous improvement of the decision support tools based on the testing and quality assurance findings. Ongoing monitoring. After implementation, continuously monitor the performance of the tools to ensure ongoing quality and effectiveness. User involvement. Keep engaging with the end users for ongoing feedback and suggestions for improvement. Ensuring long-term quality and reliability. Regular updates. Regularly update the decision support tools to reflect the latest medical research and clinical guidelines. Training and support. Provide ongoing training and support to users to ensure they are aware of any updates or changes to the tool and can use it effectively. In summary, thorough testing and rigorous quality assurance processes are vital in ensuring that decision support tools in healthcare are effective, reliable, and clinically valuable. Pilot testing allows for real-world evaluation and user feedback, while quality control measures ensure the accuracy and reliability of the tools. Continuous monitoring and iterative improvements post-implementation are key to maintaining the long-term effectiveness of these tools. Now, let's proceed to the next section. Monitoring and evaluation. Monitoring and evaluation of decision support tools. 1. Establishing performance metrics. Clinical outcomes. Define metrics that measure the impact of decision support tools on patient outcomes. This could include rates of diagnostic accuracy, adherence to treatment protocols, and reduction in medical errors. Efficiency. Set metrics to evaluate the efficiency of clinical workflows, such as time saved in decision-making processes, reduction in unnecessary tests or procedures, and overall workflow streamlining. User satisfaction. Develop surveys or feedback mechanisms to gauge user satisfaction, focusing on the tool's usability, relevance, and impact on clinical practice. 2. Continuous improvement. Feedback utilization. Actively use feedback from end users and performance data to identify areas for improvement. This could involve enhancing the user interface, updating clinical content, or addressing any technical issues. Data-driven refinements: analyze usage data and performance metrics to make data-driven decisions for refining the decision support tools. Look for trends, usage patterns, and areas where the tool may not be meeting user needs effectively. Iterative development: employ an iterative approach to continuously update and improve the decision support tools. This process should involve regular cycles of feedback, modification, and reevaluation. Implementing monitoring and evaluation findings. Regular reviews: schedule regular review meetings with key stakeholders to discuss the monitoring and evaluation findings and plan for improvements. Engaging with IT teams: work closely with IT teams to implement technical changes and updates based on the continuous improvement process. Change management: as improvements are made, use effective change management strategies to ensure smooth adoption of any changes or new features. Ensuring long-term success. Adaptability: keep the decision support tools adaptable to changing healthcare practices, technology advancements, and evolving patient needs. Scalability: ensure that the tools can scale to meet growing or changing demands within the healthcare organization. In summary, effective monitoring and evaluation are key to the long-term success of decision support tools in healthcare. By establishing and tracking performance metrics and committing to continuous improvement based on user feedback and data, these tools can remain valuable assets in enhancing clinical decision-making, improving patient outcomes, and increasing overall workflow efficiency. Now, let's proceed to the next section. Ensuring compliance and ethical standards. Ensuring compliance and ethical standards in decision support tools. 1. Regulatory compliance. Adherence to healthcare regulations: comply with all relevant healthcare regulations and standards, which may include HIPAA for data privacy, HITECH Act provisions, and other regional or national healthcare laws. Data privacy and security: implement robust data privacy and security measures to protect patient information. This includes encryption, access controls, and regular security audits. Regular updates for compliance: stay informed about changes in healthcare regulations and update the tools and practices accordingly to maintain compliance. 2. Ethical considerations. Patient autonomy and consent: address issues related to patient autonomy, particularly in how decision support tools are used in patient care. Ensure that these tools support, rather than replace, the clinician's judgment and maintain the patient's right to informed consent. Transparency: be transparent about how decision support tools function, the source of their content, and any limitations they might have. This transparency is crucial for building trust among clinicians and patients. Bias and fairness: consider and address potential biases in decision support tools, especially those that may arise from the data used to develop these tools. Ensure that they are fair and equitable in supporting clinical decisions for diverse patient populations. Implementing compliance and ethical standards. Training and education: educate all users, including healthcare providers and administrative staff, about the importance of regulatory compliance and ethical considerations when using decision support tools. Monitoring and evaluation: regularly monitor and evaluate the decision support tools to ensure ongoing compliance and address any ethical issues that arise. Stakeholder engagement: engage with stakeholders, including legal experts, compliance officers, and ethics committees, to guide and review practices related to decision support tools. Continuous improvement and responsiveness. Feedback mechanisms: establish feedback mechanisms to identify and address any compliance or ethical concerns raised by users. Adaptation to changes: be prepared to adapt and update the decision support tools in response to new regulatory requirements or ethical guidelines. In summary, ensuring regulatory compliance and addressing ethical considerations are integral to the responsible deployment and use of decision support tools in healthcare. By upholding these standards, healthcare organizations can ensure that these tools not only enhance clinical decision-making but also align with legal requirements and ethical practices, thereby maintaining trust and integrity in healthcare delivery. Now, let's proceed to the last section. Scalability and adaptability. Scalability and adaptability in decision support tools. 1. Future-proofing. Scalable architecture: design the system with a scalable architecture, allowing for easy expansion in terms of user numbers, data volume, and complexity of tasks. This may involve using cloud-based solutions or modular design principles. Flexible integration capabilities ensure the system can easily integrate with other tools and systems, both existing and potential future technologies. Utilize open standards and APIs to facilitate this integration. Resource management plan for resource scalability, including server capacity, storage, and network infrastructure, to handle increased loads without performance degradation. 2. Adapting to emerging trends. Continuous learning, stay informed about the latest trends and developments in healthcare technology and clinical practice. This includes advancements in areas like AI, machine learning, big data analytics, and personalized medicine. Regular system reviews periodically review the decision support tools to identify areas where they may need to be updated or enhanced to align with current best practices and technological capabilities. Stakeholder collaboration collaborate with clinicians, IT experts, and industry specialists to gain insights into emerging needs and opportunities for system enhancements. Implementing scalability and adaptability. User feedback regularly gather and analyze feedback from users to understand their evolving needs and how well the system is meeting those needs. Proactive updates proactively update and refine the system based on anticipated changes in healthcare practices and technology trends. Training and support provide ongoing training and support for users to adapt to updates or new features in the decision support system. Ensuring long-term relevance. Flexibility for customization allow flexibility for customization and local adaptation of the system, enabling it to meet the unique needs of different healthcare settings. Investment in innovation invest in research and development to continuously innovate and improve the system, ensuring it remains at the forefront of healthcare technology. In summary, designing decision support tools with scalability and adaptability in mind is essential for their long-term success and relevance. By future-proofing the system and staying attuned to emerging healthcare trends and technologies, healthcare organizations can ensure that these tools continue to support effective clinical decision-making and adapt to the evolving landscape of healthcare delivery. As we come to the end of this episode, remember, by following this framework, healthcare organizations can develop effective mechanisms for providing ongoing clinical content and decision support tools, thereby enhancing the quality of patient care and supporting healthcare providers in their decision-making processes. If you found this content valuable, please like, share, and subscribe to Professional Certifications channel.